we're from the UCONN Sign program, we're nursing students, and our presentation today is on diabetes management. My name is Nikki, and my group members are Sarah, Jessica, Christina, and Sam. So our target population and community that we're trying to reach with this presentation, men and women ages 65 and older with a diagnosis of diabetes that attend the Windsor Senior Center, and this can help better manage their disease. So diabetes mellitus, this is the health problem that we focused on. So it's a disorder in which the body does not produce enough insulin or respond normally to insulin, causing the blood sugar levels to be abnormally high. So consistently high blood sugar can cause tissue damage throughout the body, and poorly controlled diabetes can lead to many different complications in the body. Some of those are skin conditions, such as wounds that won't heal. You can have eye complications such as glaucoma and cataracts, neuropathy, which is nerve damage. You can have altered sensation and numbness, kidney disease, which is reduced capacity to filter the blood and excrete toxins. And you can also have swelling, heart attack, damage to the veins and arteries that make the heart have to work harder. And then you're also at increased risk for stroke. When the blood doesn't flow as well as it normally should, it can stagnate and cause clots, leading to strokes.
Hello, I'm Sam. I'm going to tell you the difference between type 1 and type 2 diabetes. But first I want to highlight the fact that it's important to know what the role of glucose and insulin do in your body to understand what diabetes is. So after we eat, carbohydrates turn into glucose, and that glucose is absorbed into the bloodstream. Our pancreas, a healthy pancreas, produces insulin to help our body cells absorb that the glucose. But someone with diabetes doesn't have enough or doesn't have any insulin to help absorb the glucose to produce energy for your body. Type 1 diabetes is a condition where your body produces little to no insulin. And type 2 is your body produces insulin, but it's not used efficiently in your body. The goal of insulin therapy for type 1 is replacing insulin so that your body does not naturally make. And type 2 diabetes use insulin therapy to keep the blood sugars within a normal range. And both of those are used to prevent the complications that arise from diabetes. Okay. Recognizing symptoms of high blood sugar early is vital because if left untreated, it can lead to severe life-threatening conditions such as acute or chronic kidney injury, coma, or death. Early signs of hyperglycemia are warm, dry skin, frequent urination, increased thirst, blurred vision, fatigue, or headache. And later symptoms are fruity smelling breath, nausea, vomiting, shortness of breath, dry mouth, weakness, confusion, and abdominal pain.
All right, so my name is Jessica, and the treatment for hyperglycemia is insulin administration. So it's important when taking insulin to carefully monitor your blood sugar. Careful monitoring is required to ensure blood sugar levels stay within your target range. A good rule of thumb is to check your blood sugar about 4 times a day. You want to check it before meals, after exercising, before bed, and more frequently on sick days. Your provider also might order an A1C test, and that'll check your average blood sugar over the past 3 months to see if your insulin treatment has been effective. So just some tips for careful blood sugar monitoring is to check glucose levels more frequently when you're sick. You want to remember to still take insulin when you're sick, even if you're not eating much, because blood sugar levels are actually higher when you're sick, and so you may need more insulin. The dosage and frequency of insulin administration is going to depend on what your blood sugar is, how your diet is, whether or not you exercise, and the treatment plan that you've come up with your provider. So for insulin administration, this is just how you administer insulin, just to make sure it's being absorbed properly and that you prevent infection. It's always good to go over these steps. So the first thing you're going to do is wash your hands. You want to check the expiration date on the insulin bottle just to make sure that it's still good. You're going to remove the lid and clean the rubber top with an alcohol pad because that lid on the bottle is not sterile. You're going to pull air into the syringe, usually the same amount that you're planning on taking out of insulin. You're going to push the syringe into the rubber top, inject the air, and then pull out the desired dose of insulin. You want to clean your skin thoroughly. You can usually administer insulin in the back of the arm or in the abdomen. It's important to clean the skin because you want to prevent infection. You're going to pinch the area of the skin, and then you're going to go in 45 degrees or 90 degrees depending on how much fatty tissue you have in that area. Push the needle into the skin and let go of the pinched skin. And the most important part that we seem to forget is to leave the needle in place for 5 seconds just to make sure your tissues are able to absorb the insulin.
So my name is Christina, and I'm going to be going over the signs and symptoms of hypoglycemia. So hypoglycemia is defined as low blood sugar, anything less than 70. Hypoglycemia can be due to too much insulin being given, taking insulin without eating first, and exercising. So glucose is the main source of energy for body and brain. You need glucose to function appropriately. If untreated, it could lead to seizures, loss of consciousness, coma, or death. Some signs and symptoms of hypoglycemia include shakiness, nervousness, and anxiety, sweating, chills, irritability, confusion, fast heartbeat, nausea, pale skin, headache, lack of coordination, seizures, or coma. So causes of hypoglycemia. So insulin would be using the incorrect insulin type, too much insulin, or injecting into the muscle can cause hypoglycemia. Food could be too few carbohydrates, low-carb foods without adjusting insulin amount, and fat, protein, and fiber can also impact the absorption rate of carbs during a meal. Exercising, body needs more sugar to supply energy to the muscles. Exercising uses more sugar, which causes blood sugar levels to decrease. It's important to eat a snack before exercising and check sugars after exercising. So the treatment for hypoglycemia, so if you start to experience signs and symptoms of low blood sugar, you'll test with your glucometer. If levels are below 70, you'll do the rule of 15, which you consume 15 grams of carbs, recheck the blood sugar in 15 minutes. If the blood sugar is still low, you'll repeat steps 1 and 2. 15 grams of carbs can include glucose tabs, 4 ounces or a half a cup of juice or regular non-diet soda, 1 tablespoon of sugar, honey, or corn syrup, hard candies, jelly beans, or gumdrops.
And I'm Sarah. I'm going to go over the tertiary prevention that we came up with, and we're going to go over diet management first and then exercise. So for diet management, we want to make sure we're eating a healthy diet. That's essential in maintaining good glucose control. We want to limit foods and beverages that contain added sugar or high in fats or that are fried. There's some research on a Mediterranean diet. I'm not sure if you've heard about it, but it's basically a diet that's high in plant-based foods, vegetables, and it has moderate fish and dairy intake. And then it also has low red meat and red wine. And then in addition, there's functional foods, which are foods that contain biologically active ingredients that provide health benefits, and they aid in the prevention and management of chronic diseases like type 2 diabetes. And with these foods, you want to look for ingredients that contain polyphenols, terpenoids, flavonoids, alkaloids, sterols, pigments, and unsaturated fatty acids. So you can find those on the nutritional labels of the food items. And all of those ingredients contain antioxidant, anti-inflammatory, anti-cholesterol properties, and they increase insulin sensitivity and decrease resistance. And then exercise is also important. So daily regular exercise helps to increase insulin action and enhances glycemic control and insulin signaling, which promotes weight loss and improves vascular function. For type 2 diabetes, the ADA recommends a minimum of 2.5 hours of moderate, vigorous exercise a week, which is usually spread out over 3 to 7 days with a maximum of 2 consecutive days between each event. It's also recommended to do resistance exercises about 2 to 3 times a week, non-consecutively. And the goal for that is to utilize about 10 different exercises and completing 1 to 3 sets with 10 to 15 repetitions each. And you also want to engage in flexibility and balance 2 to 3 times a week. And then combined with diet modification and regular exercise, that is vital to preventing and managing type 2 diabetes. So in conclusion, we went over a lot of different things about type 2 and type 1 diabetes, about the differences, risk factors, the importance of glucose monitoring, the signs and symptoms of both hypo and hyperglycemia, how and where to inject insulin properly, and the importance of exercise and diet management